join us. D021312, we have a light lunch and our speaker today here in person. So before we begin, good afternoon, everyone. I'd like to make a brief land acknowledgement. McGill University is on land which has long served as a site of meeting and exchange amongst Indigenous peoples. We acknowledge and thank the diverse Indigenous peoples whose presence marks this territory on which we now gather. For today's rounds, we will have an open mic period after the presentation. So for those of you who are here and want to ask questions, just raise your hands and I will ask you to unmute and you can ask your question. As well, you can still enter your questions in the chat as we normally do. And finally, just a reminder to please answer a brief survey that will be sent to you immediately after the presentation. This will let us know that you were present today. So finally, we have a guest speaker today, courtesy of Dr. Rita Suri and her team in the Division of Nephrology. And our speaker is the editor-in-chief of the CMAJ, the Canadian Medical Association Journal. So Dr. Kirsten Patrick is here with us today. Dr. Patrick is a physician with 19 years of medical editing experience at the BMJ and the CMAJ. She did her medical school in South Africa. And following that, she did residency training in anesthesiology and critical care in the UK. And she did a master's in the global health policy. And as I mentioned, she's currently editor-in-chief at the CMAJ. She came to Canada in 2013 to take up a full-time deputy editor position at CMAJ, and she has worked at the journal since then. Lately, since 2022, as its editor-in-chief. She has written up and published research contributing to the drafting of guidelines, ethics and best practice guidelines for training experience in global health. And I look forward to hearing her presentation today on medical journals, an important part of health systems or increasingly irrelevant. Thank you. Thank you so much for joining us today, Dr. Patrick.
So thanks to everybody who's come out to listen, and thanks to all the folks who are online. I believe there are a lot of you. I thank you, Dr. Suri, for inviting me to talk. It's great for an editor to get above the parapet of their computer screen to talk to real people. And what I hope today to make you care about, I'm not, we have a talk where we give the classic rundown of what editors want when you submit to a journal, and I'm going to give that talk later in the Research Institute. What I'm hoping to do with this talk is to convince you that you need to care about your national medical journals. So in the title of this presentation, you can imagine that this for me is a rhetorical question. Obviously, my competing interest is that I'm paid to be the editor-in-chief of the CMAJ. And so I have an interest in selling you on its importance. But I also hope to be able to convince you that journals are still important conduits of health information and that they should continue to be so moving forward, that it's really important for you to engage with them and understand that they're also your voice. CMAJ has been publishing continuously for 114 years, and the reason for its inception was that the CMA wanted a place for their many thousands of members to be able to publish and speak to each other. And I think that even long after I'm no longer its editor, that will depend on you as much as on me, whether this journal remains important in the Canadian landscape. And what I hope you'll come away with after this talk is a better understanding of the role that journals have played historically and now play in well-functioning healthcare systems. And maybe with a desire to engage with CMAJ as Canada's national medical journal to optimize what it brings to our healthcare system. So I've put a cheeky image on here, and sometimes I ask the audience, what do you think this is? Hey, don't worry, you're not supposed to know the answer. It's actually just a picture that I took off the internet. It's not the first meeting of the CMAJ editors or anything like that. But I like it because it illustrates a concept that we talk about that journals are trying to evolve away from, and that is good old boys sat around the table, or gobsats. So I want you to think a bit about where CMAJ originated, which was definitely a gobsat, and where it's going. And in a little while, I'll come to a history lesson. But first, a framework for the healthcare system, which is probably like telling you what you already know. I like to start this way. This is the WHO's 2007 Health System Framework Schema. It's from the organization's Framework for Action on Strengthening Healthcare Systems. And the model's since been updated to be a more circular format that centers people. But I like this one, this building blocks version, because it shows really clearly where information plays a role. So for health systems to operate optimally and to actually help people have optimal health and respond quickly to treat their diseases without bankrupting them, we need good services and drugs and products and a skilled workforce, but we also need information to back up all of those things in the generation of drugs and workforce planning, for example. And we need leaders to make health and policy decisions about optimal allocation of funds. Ideally, all this information should be, all these decisions should be guided by reliable and robust information. So I'm curious who has ever read a CMAJ article in the room. Yay, some of you have. That's cool. I'm messed up this slide a little bit. I'm not sure where you've read the CMAJ, so I wonder how you found your way to the journal. One of the things that CMAJ does really well is feed its published articles out to the media. So the Canadian media really respect CMAJ as a credible source of medical information. And so most weeks a CMAJ article will appear in news media. And you may have seen stories in local news. Or perhaps some of you read that publication that claims to be Canada's national newspaper. We're in there sometimes too. You might have seen one of our editors speaking on national TV, or one of the authors of our articles being interviewed on national TV. On the right in this slide is CMAJ's deputy editor, Dr. Catherine Varner. She's an emergency physician. She's one of Canada's leading experts on pregnancy care as it interfaces with primary and emergency care. And she's written in the last couple of years a series of hard-hitting editorials about crises in Canada's emergency departments. She's a real rock star. You may even have read about CMAJ articles in international media. So increasingly when I do outreach, people will tell me that they don't read CMAJ, but they do engage with the podcast. It's a bi-weekly podcast. And perhaps you fall into that category. I'm not sure if you've ever listened to our podcast. According to our podcast platform's metrics, the podcast is downloaded all over the world, but mostly in North America. When it comes to Canadian regions, we have reach across the country. It's very Ontario and Toronto centric, really, but there is reach across the country. Only 3% of Canadian listeners come from Montreal. So that's why I'm plugging it here. But not only that, the CMAJ podcast is actually consistently the top ranked medical journal podcast on the Apple charts. So mid-February of this year, the next closest journal podcast, JAMA's Critical Reviews, I think it's called, was 16 spots below CMAJ's. And the next one is NEJM's, which is 36 spots below us. no other medical journal podcasts sit in the top 60 spots in the Canadian medicine category, neither Canadian nor US. So it seems to be filling a really important gap, and we seem to have a good recipe for that podcast. The problem is it's about one article and it's every 2 weeks. So it's kind of really only presenting about 1/20th of the information that we produce. Okay, increasingly when I do outreach as well, people say that they prefer to read in print. So I don't know about this. We did a print survey. We don't know who the denominator for the survey, but the people who did take the time to respond to the survey, 85% said that they read it every issue. Print is the journal in its historical form. People still obviously like paper. And this is a reasonable segue into me talking about how journals came to exist in the first place. So maybe just if you wouldn't mind indulging me in a little history lesson. Now, this slide depicts some journals that you probably know of, maybe one that you don't. And there's an outlier here. It's not maybe the one you think. The first scientific journal was Philosophical Transactions, which was started over 350 years ago in 1665 by the then Secretary of the Royal Society. And the intention he had was to promote the enterprise of early modern science. So, as I'll come to later, journals were essentially initially developed to solve two problems with scientific discoveries: dissemination and registration. So before 1665, scientists and also learned gentlemen with strange interests communicated largely by letters to one another. And this guy, Henry Oldenburg, thought, well, there are too many of these actors now. It would be great if they just sent all their letters to me and I put them in a journal and mailed it out to anybody who paid for it. So he would typeset prints and bind the letters into this new thing called a journal, mail out copies to all the other subscribing scientists at once. Dissemination solved. And then the product got scaled. It was also a way for a record to be kept. So this is what we might refer to as registration. It would be of both the scientific discovery and of who discovered it. Somewhere that record was kept. And although this journal did have an instrumental role in convincing vaccine-hesitant doctors and the general public of the early 18th century in England of the effectiveness of the smallpox inoculation, Philosophical Transactions wasn't a medical journal, so it's an outlier in that sense. But mentioning it helps me to draw the theme for this, which is a common theme among medical journals, which is that they are owned and published by a professional society. They come out of a professional society wanting to get the message of their members out there. And most of the other journals pictured on this slide are society-owned medical journals. So the forerunner to the New England Journal of Medicine was first published in 1812 by two Boston physicians and then bought by the Massachusetts Medical Society 99 years later. JAMA, on the other hand, was actually established by the American Medical Association in 1883. It was a newsletter of society proceedings, but then became a journal. The BMJ also started life as a society journal in 1840. It was the Journal of the Provincial Medical and Surgical Association, later became the British Medical Association. And then, not to be outdone, the Canadian Medical Association launched its journal in 1911, and the CMAJ has published continuously since then. So I'm deliberately laboring this point about medical association journals because the CMAJ is owned by a medical association with which it's had a bit of a fraught history. And because there was a time between 100 and 150 years ago when professional associations saw owning a journal as a status symbol, a way to make money, and a place for their eminent members to publish. A place, as the comedian Hannah Gadsby might say, for men to name all of the things. So naturally, the gobsat of Canadian physicians at the CMA also wanted a place to showcase their contributions to medical science. That's how we ended up. Then a little bit further down the line, decades down the line, maybe we weren't making as much money, or we annoyed the association, and so there have been a few forced interactions. Now, I left out the Lancet because it's a bit of an outlier. It was the first in the category of publications that one might call disruptor. And it's never been a society journal, so that's why it's an outlier on this slide. It was launched in 1823 by a 28-year-old general practitioner, and what he wanted to do, Thomas Wakeley, was to inform and reform. So he wanted the Lancet to be for the profession at large. Now, before that, these society journals were just for academics, and they would be distributed to academics in cities. And what the editor of the Lancet wanted to do was to make this information available to everybody, right? Well, not everybody, but all doctors, the ones who practice in the country. And so he did this thing where he would go to eminent lectures in London and then, without permission, republish them in his journal. And it got him in a bit of legal hot water. He also published interesting case reports, medical news, articles that would entertain doctors as well. So one man, still not a woman in sight. Okay, so thanks for indulging me in that history lesson. I guess I'm trying to underscore that medical journals have been around a while, and it's part of the reason that I use to explain to people, including to CMAJ's owner, the CMA, that CMAJ is a public good and shouldn't be treated lightly. It shouldn't be let go of lightly. We need to make sure it continues. So, given the disruption that's come around to publishing since the creation of the World Wide Web, do we need these journals anymore? Several people have raised this question and considered whether they're good for anything now. Now, I created this figure by drawing mainly on the contents of a lecture that was delivered in 2016 by Richard Smith, who was a previous editor of the BMJ. And he is very famously kind of sarcastic and caustic. And I said earlier that I think that journals contribute or should contribute meaningfully to health system information. But Smith took this more cynical view, and he categorized all the ways that journals were possibly functioning, and then he scored them. So he acknowledged that they publish scientific information in the form of research findings, and that's what most people might say they do. And incidentally, there are still at least 30,000 medical journals, and maybe even more every day, some of which are predatory journals, but that's a subject for another talk. Some journals only publish research, but he argued that journals actually do a very poor job of that, and that they don't, on the whole, help with the timely translation of scientific knowledge into practice. And I think the point that Smith was making was that by the time we peer review and publish scientific information, especially educational information, it's outdated, right? So there's no future for medical journals, essentially, because that will be that function can be better served by other things. He said many medical journals also aim to meet their readers' continuing educational needs, to inform through news articles and editorials. These are more like general journals, and to provide a forum for opinion and debates, to lead discourse on important issues, or to set research or policy agendas. So if you think about setting policy agendas, think about the Lancet's global commissions. And entertainment may not be something that many would associate with scientific journals. And people would ask if they should aspire to be entertaining. I think we do need to at least think about how people's attention is captured now, and how difficult it is in this attention economy to capture people's attention. So we need to think about entertainment a little bit. And then the pieces in gray, Smith said that making money, playing a role in ranking academics and promoting drugs for pharma were essential roles of medical journals and actually thinks that they did better than their primary functions. He was a very cynical guy. Another person, Michael Clark, publishing consultant in 2010, also asked the question, why hasn't scientific publishing been disrupted yet by the internet? And he thought that scientific journals had been created to fulfill these 5 functions. So registration and distribution of research I talked about earlier in the history section, and I think we can all agree that the internet has managed to disrupt registration and distribution. Like anybody can publish anything, anytime, post their findings on a repository, write a blog, anyone can self-publish. But Clark suggested that the functions of validation, designation, and filtration, which is essentially what happens when science goes through peer review and the editorial process to ensure its optimal robustness. He said those are more resistant to disruption because they still require a human and community input. And I think we saw that during the COVID-19 pandemic. Suddenly journals became very relevant. The New England Journal of Medicine received 4 times the number of submissions that it would ordinarily have in the first year of the pandemic. We received in some categories nearly 3 times as many submissions. So it was definitely a place where people wanted to publish their stuff. And yes, the processes of validation and filtration can seem slow and imperfect. And they've led to the rise in the use of preprint services, but there are downsides to being fast, which I'm going to come to. So medical journals as a way of evolving, it used to be a very ivory tower, black box kind of place. You would submit something to a medical journal, some good old boys sat around a table would make a decision, consult their friends who were peer reviewers, and then some things would get published and some things not. And I think journals recognize that this is not equitable, but it's also not very helpful for the healthcare system because these people are biased in what gets published and what doesn't, right? So medical journals, a group of medical journals developed the International Committee on Medical Journal Editors, or the ICMJE, which has set a bunch of best practice standards, for example, who qualifies for authorship on a paper, and suggesting that randomized trials be registered before recruitment of patients begin. Most also follow standards outlined by most medical journals also follow these standards outlined by the Committee on Publication Ethics, which is a bunch of standards essentially to prevent scientific misconduct in research. The last 2 decades have seen the rise of open access, also championed by some journals, although obstructed by others, which challenged this historical model of publicly funded science, then going behind a paywall when it was published. And that would limit its usefulness because it wouldn't be able to reach some people who would need it, especially in countries that were not wealthy. And never mind being behind a paywall, sometimes medical science was just plain useless because it was poorly reported. And so the last 2 decades, also backed by journals, has seen a movement to improve the usefulness of scientific findings through clearer and more transparent reporting. And the Equator Network is a clearinghouse of robustly developed reporting guidelines, thousands, that cover any study design you might want to do. So journals have also been behind important movements to increase the availability to decision makers of all scientific information, backed by the BMJ. All trials came into existence to try to ensure that all trial results were published, because it was very clear that there was a bias that journals were publishing only trials with positive outcomes and not ones with negative ones. And so that influenced what we would know about what worked and what didn't work. So I just wanted to talk about the need to acknowledge that sometimes journals get things wrong. Yes, we fulfill an important function in ensuring robust information. But journals get things wrong, badly wrong, especially when they try to be fast or sexy or both. And we saw some high-profile retractions in medical journals in the early part of the COVID-19 pandemic. Two examples here from the Lancet and the New England Journal. And this was when journals were rushing papers through the peer review process in an effort to be first putting out new information. It's really important that journals admit quickly when they've published something that's not okay, and to be transparent about it and learn from their mistake. And that's why when a paper is retracted, it stays there so that it stays in the repository so that you can see what it was, but it gets this big label on it that it's been retracted. And the editors of the Lancet did write an editorial reflecting on how they learned from their mistake. In terms of speed of publication, in June 2020, a scientist in California wrote in The Economist, "A new era of science is emerging and it cannot come fast enough. We've been pushed by circumstances to conduct research at speed, scale, and scope that I'd only ever seen in novels and films." And yeah, it was quite something. It was really something to see how scientists collaborated internationally across countries and get research evidence out there, how the research infrastructure was set up so that research could be done fast, and the speed that with which findings were published. And it is definitely something that medical journals could do better. But as of 2 days ago, Retraction Watch had recorded 511 retracted research papers related to COVID-19 from both journals and preprint service, and also 19 expressions of concern from journals. So that's when you don't retract the findings, but you put a big notice on it that says, the journal is concerned because. So on the one hand, that's evidence of an accountability mechanism working. And on the other hand, you got to think about when a fearful public reads about high-profile retractions every other week, it's something that can influence public trust in science, and we need to be thinking about that too. All right, so circling back to my model and Smith's fairly cynical opinions on the functions of medical journals, and he actually scored them. He gave a 2 out of 10 score for publishing and organizing science, for example, and a 4 out of 10 score for education, and then very cynically said that they got 9 and 10 out of 10 for making money and enhancing people's careers. He is quite famously pessimistic about the future role of medical journals, and he wrote on the announcement of the retirement of Jeff Drazen as former EIC of the New England Journal, that the main job of journals will not be to disseminate science, but to speak truth to power, encourage debate, campaign, investigate, and agenda set. The same job as the mass media. The NEJM needs to strengthen that side of the journal. And for this, he was roundly criticized by many US physicians and academics, telling him to mind his own business. Thanks very much. They like their medical science politics free. But I'm not sure that I disagree with him entirely. What he said may have been arrogant, but I don't think he was all wrong. I do think that journals exist to drive an agenda. And one of your colleagues asked me today, what was my agenda for the journal? And I said, for CMAJ, and I said, well, I'm its custodian and I don't run a dictatorship. So it's not really about my agenda. We do have a strategy exercise every year to think about where we're going. But in my mind, what's really important is that first diagram of the framework for healthcare, and that what CMAJ is doing its utmost to produce good, high-quality information that can actually serve the healthcare system. There are problems in Canada's healthcare systems. What is CMAJ publishing that can help a little bit to solve those problems, to guide policymakers, to guide clinicians in what they do? Not just articles on the size of the problem, but also things that offer some solutions. I think that medical journals still have to try to be as good as they can at publishing robust science and useful information to guide policy, but they have to do a whole lot better at publishing and communicating, because we are struggling in this attention economy, and we need to get our stuff out there. And disinformation is just growing and growing and growing. And we're kind of producing this stuff. And unless we get it better at getting it out to the general public, we're not doing a good enough job. And right now, with things that are happening the south of our border, it's pretty difficult for medical journals not to respond to political threats. Even JAMA and the NEJM have done that. So when it comes to standards, if I'm going to focus in on CMAJ, we do adhere to the standards of the ICMJ and code in our editorial processes. And in 2020, we chose to become an entirely open access publication. So that was from the advocacy of previous editor Andreas Lapakis, and he lobbied the CMA because it was something that they would need to support financially. It would cause loss of revenue for us, since they would need to make up the deficit. So that was great. We've been entirely open access across all article categories since 2020. It's been a good thing from the point of view of our publications are now much more widely accessible and more widely read than before, when articles were behind the paywall for a year. And CMAJ has had to evolve in a shifting publication landscape in which we've seen, for example, rising use of preprint servers by authors, which led to our developing a policy on permitting the use of preprints with conditions. So I've just given you as many examples of CMAJ policies as could fit on one slide and still be visible. Notwithstanding recent executive orders banning the mention of race and ethnicity, increasing awareness of the way that bias plays out in medicine led to CMAJ developing last year this guidance on the reporting of race and ethnicity in CMAJ research papers, and it was a bit of a leader in that regard. And with the development of AI and machine learning tools that may be used in the conduct and reporting of writing of scientific articles, editors have had to develop guidance for authors submitting on how they use AI in the preparation of submissions and the conduct of research studies and how they need to report that. All that's to say that as understandings, technologies, practices change, journals will need to adapt to meet new challenges and to continue to ensure that they're relevant. And we recognize that. And again, to make sure that what they produce is optimally useful and support effective health systems. Okay, so now I'm going to focus sort of more granularly on CMAJ and give you a little window on what we do. What do we have here? Aside from the cardinal sin of a table without a title or footnotes, this is the 15 most read CMAJ articles in 2020 that were published in 2020. And you'll see from my little icons that most were unsurprisingly COVID-19 related. I've marked those with little red viruses. Of the three that weren't, one at the top of the list was this really game-changing guideline on the management of obesity. So that guideline was game-changing because it was the first guideline on obesity that talked at length about stigma and not fat shaming. And it's been hugely popular, taken up across the world and highly cited. One was a practice case report that was subsequently retracted. I think retracted articles are often very well read because people want to find out what went wrong. And then the one that I've highlighted there in green was an analysis article on the effect of smartphone and social media use on youth and mental health. And I've highlighted it because I'm going to use it as a little case example later in a minute to illustrate how the process of publication in the journal can shape a paper and improve it, and how much teamwork there needs to be. And then just, just in case you're interested, here's a similarly badly behaving table showing the top 10 CMAJ articles published in 2024 and their hits in 2024. And I'll leave you there for a few seconds in case you're interested in the topics. So remember the article that I had highlighted in the previous slide, with permission from the authors of that paper. And the reviewer, I quote, I'm going to give you an idea of the genesis of that article. In the next slide, so this is a pitch that I received from the authors. Actually, it wasn't the first pitch that I got from them. The first author contacted me about the idea for this article on February the 5th, 2019. So you'll remember that this was published in 2020. And his email said, as I'm sure you know, over the last several years, there's been a large increase in the number of adolescents presenting with affective difficulties, self-harm, and suicidality. Increasing evidence points to use of smartphones and social media as playing an important role in mental health difficulties among adolescents. A couple of colleagues and I have written a review looking at the evidence for this relationship. Okay, let's see. This is a topic with considerable public health implications and of high relevance to a broad medical audience. Are you interested? Well, was I? I was certainly intrigued because at the time, I was the mom of two teenage boys, a middle schooler and a high schooler who spent enough time online and on mobile phones that I did worry for their mental health and their developing brains. I didn't necessarily know if CMAJ would be interested, though. Would the article be something that could offer useful, actionable knowledge for our readership, or would it mostly raise questions and tell us what we already know? So I replied saying that I'd love to discuss the proposal with my colleagues, but we need a little bit more information, specifically a slightly more fleshed out summary of what they plan to write. This is what they sent. And what I generally ask for is a brief introduction that specifically answers the question as posed by a CMAJ reader, why should I read this article now? So the answer to that question cannot be because I want to write about it, because I'm really interested in this topic myself. It's like, why is this important for CMAJ's readership? And then some subheadings outlining the main themes to be covered with bullet points under each. And so that's what they sent. And what we liked most with this is that they ended with clinical implications and proposed interventions. So they said they would propose evidence-based solutions for problems grounded in evidence. And I knew, because I had read around this issue, because of my problem with my kids, that there wasn't a similar review of this kind of evidence out there. And I said, okay, yeah, do submit. The authors submitted and we sent for external peer review. And we had excellent peer reviewers, really excellent peer reviewers that were helpful. They were a bit underwhelmed, actually. Here's a snippet from one reviewer. Basically, he said they cherry pick the evidence and their argument doesn't follow well from the evidence that they present. So does that mean that we threw the submission out? You know that we didn't, because I already told you that we published it. But the reviewers had offered some good suggestions for revision, and the editors thought they knew how we could shape the article so that the evidence was better presented and the argument more carefully constructed. And so we rolled up our sleeves. And I sent the authors a line edit that looked like this. And I know that some of you are sitting there thinking, oh my goodness, that is brutal. That is just brutal and unnecessary. And when I do send an edit like this, the reason I'm doing it is because I don't want to send the authors or the reviewer comments and then they come back and then I send it to them again for revision. If I think we're going to take something forward, I want to apply CMAJ style and then say, okay, this is the style you need to follow, adhere to the reviewer's comments, and we can then accept the next version. So when I send an edit like this, I always send it with this cheery note to say, good news and bad news. The good news is that we want to publish. The bad news is that there's a lot to do. And all the asks, including the edited version, may seem overwhelming. But the rest of the good news is that we've done a lot of the work for you in terms of applying journal style, tightening up the structure of the argument, and providing specific in-text prompts for what needs to go here, reference here, a guide for how you might write in an evidence-based style. And soon the authors could see, I think, that we were on their team. And we got back a revision that addressed all the many comments, and the next version was accepted. Published then in February 10th, 2020. So after a fairly long process. It was published just before the pandemic was announced. And probably that contributed a little bit to why it was one of the top 10 most read papers as kids were going into online school. It's not the whole story, though. And if you look at the old metrics for the article, you can see why. So in the previous tables, we were stratifying the top articles by year of publication. If we don't stratify our articles by year of publication, then this article has, since it came out in 2020, consistently been in the top 3 most read articles on the CMAJ site from week to week. So it's had longevity. And the graph in the slide isn't helpful because there's no y-axis information. When you view it online, you kind of hover your mouse over one of the lines and it gives you the y-axis information and the data. That line that starts off at the bottom on the left and steadily rises, that represents citations. And it was 411 citations at the time of screenshotting on the 28th of March. So that's pretty good for a non-systematic narrative review article for CMAJ. And the other 2 lines depict media and social media attention, also being noticeable for being sustained over 5 years. We had a podcast episode on this article, I think last year, or maybe at the end of 2023, because it was just boggling our minds that it was still so popular. And so we invited the authors back and a couple of experts on child mental health to have a podcast. The podcast is also the second most listened to or downloaded podcast. So it's obviously a topic that has resonance. And all of this tells me that this article filled a gap at the right time. And that's essentially what we're looking for. Not every article that gets published in CMAJ or gets submitted to CMAJ has to be that or will be that. But it is great for authors and editors when their article fills a gap in this way and has such a sustained reach. The article drew a lot of scattered evidence together before that had been done before. And it talked about a problem that was just about to become a much bigger problem. So that was serendipitous and we didn't have any control over that. And it made some very thoughtful suggestions that came from careful, critical appraisal of evidence when there was a policy vacuum. So it went on to have some kind of reach. It was a pleasure for me to work on this article as its editor and to see its popularity year on year. And it has been that way for me for many other articles. That's why I enjoy my job so much. So I just, wanted to end there with that, what I think of as a good news story, although some of you might be sitting there going, oh my goodness. And I know that the feedback that we get quite often is that the CMAJ asks for too much and the asks are too onerous. And that is something that we're trying to address. But I hope that it can give you some idea of how we help you to shape something that is better than even what you had imagined it could be, and that you can be proud of it in the long term. So I'm going to answer some questions now, I think. And if they're really difficult, I'm going to ask my colleague, Ken Flagel, to answer them.
Thank you. Thank you very much, Dr. Patrick, for this really informative and comprehensive lecture on medical journals and the CMAJ.
I'd like to open the floor for questions. Do you mind if I close this?
Yeah.
Okay. Is there anyone in the audience that has any questions for us? Mark, Dr. Roger, go ahead, please.
Yeah, thanks for the brilliant comment to the percent as you say, science, and so
There's a lot of comments in here.
You know what?
Sorry, can I ask you to
Yeah.
just maybe repeat the question and speak in the microphone? Thanks.
So the question was about whether the publishing model would change, because the majority of journals are housed within these big publishing houses that do make money. They charge a lot. Some of them charge submission fees. Some of them charge fees for publication in order to make their journals open access. And the other model is that the reader pays. So as you'll find when you Google something, you might find a study and then you'll find that it's behind a wily paywall or something. And this has been a long problem. And you asked, is this something that you'll still be reading about in 10 years? Goodness me, I think 10 years ago, the open access movement really hoped that they wouldn't be reading about it in 10 years. And I'm not convinced that it's going to change. But I do think that supporting open access can help to shift the needle. So there is something that each of us can do. As journal editors, we advocated to the CMA saying the CMAJ and the contents thereof are a public good. We'd like it to be open access. Please pay. You have a lot of money now. And they did. And journals can do that. Journals with power can do that to a certain extent. But it is a huge business. And what we're essentially asking for is for that business to be eroded, and people don't walk away from money that others are willing to pay. So I have to say that that's where my skepticism lies. Like, I think journals are useful, but I don't think that the way that journals are published is going to become better anytime soon.
Thank you. David Rosenblatt, do you want to unmute? Because I see that you have some questions and comments, David, and then maybe Matthias Friedrich also. Go ahead, David.
Yeah, having trouble unmuting, but I guess you let me do it now. So just a couple of maybe comments and questions that they're all in the chat, so you can read them as I go along. So many of the scientists that I know now don't read journals per se. They do a PubMed search for subjects that they want. And many people who have won Nobel Prizes publish in journals that are quite obscure, when they go back and look at it. And Mendel's work had to be rediscovered. So it's more, for my mind, it's more a matter of where good science is published. And leading into that, many of my European people have told me, collaborators, that they'd rather not publish in a journal that has a citation index or an index factor of less than 5 because it's bad for their career. They'd rather leave the science unpublished, which I think is very anti-science. And what are your thoughts on that?
So many things there. Yes, that is. I remember when I was still at the BMJ in 2011, they did a bunch of work to figure out how their readers read the journal, and they could put them in categories. So there would be the loyal readers, the loyal online readers who would browse about a bit. The majority were clinician scientist types who would read like a parachute in reads. They would find it on a Google search. Actually, nobody comes to our homepage at CMAJ. They come to us by Google if they're looking for a specific topic. Having said that, though, I do think that journals can create some sort of a feel of a community. And CMAJ certainly does that. Like, we've recently decided for climate change reasons to reduce the number of print issues that we produce. And we have a very loyal print readership who like having the paper in their hands. So there's been a little bit of a commentary on that. And the other thing that you were saying is about impact factor. So that is also tricky, and I'm not going to lie, it's something that we think about. When we're considering submissions and what we will publish, we are also thinking about our impact factor, because people will submit to journals by impact factor. I think what we have to do, being in the kind of second tier of general medical journals, we're kind of at the top of the second tier of general medical journals. What we have to do is give researchers other reasons to publish with CMAJ. So what I said in my talk, what we do really well is we get stuff out to the media and in front of policymakers. And we had people coming during the pandemic saying, we really need to have this in CMAJ because it's important for Canadian policy. And we could send it to the Lancet or JAMA, but we're sending it to CMAJ because we know that you will get it out there. So I think that's something that we offer now quite well. I think that we don't do well is that we're slow, which is that we get criticism about that sometimes. We're slow and we're picky, and our customer service could be better. So it's like it's working on that. I would love to see our journal as more of a community, but that takes resources, to be more interactive with members, to scale up the podcast, to have an online forum. Those take resources.
Thank you. Matthias, did you want to unmute? Because I know you have some questions and comments. Matthias, go ahead.
Yeah, yeah. First of all, thank you very much. Really a fantastic talk, so interesting and well presented. And I share a lot of your concerns. One way I think journals could improve, let's say, their sustainability in this rapidly changing world of information and misinformation is if they would do what you exactly already alluded to, becoming promoters of articles that they consider good and important. So being a channel to give information that is relevant to the public, but also to clinicians through the media that are currently attended to. So social media, newspapers, TV, or whatever. This of course cannot happen for every article, but actually improving on that end would help in our society where the attention span is rapidly decreasing, to elude the messages and promote them. And I think this is something that journalists have not done very well in the past. But I think those journalists who do that well will also be the journals that scientists want to send their articles to, because they know they get visibility. And it's a win-win because the journal then also has a good impact factor. So I think that's a very important direction from my end. And the other comment I just had was regarding the publication costs. I think in the past, why people did not move to open access was clearly the money that could be made with journals. I myself was chief of the publication committee of the International Society for Cardiovascular MR, and it took me about half a year to convince the editor-in-chief to go open access, because he was afraid, open access, those are the low journals, so the people will not submit. But it was a good move, as well as for the CMAJ. And I think the publication costs that are associated with that, I think they could be much less. And then a lot of that went into print media, and a lot of that to publishers who made a lot of money with. But the chance for society held journals clearly is, as you did, and then that's why I think the CMAJ did a fantastic job, is to have the societies take responsibility for that. So those were just comments. I want to congratulate you also for your great work in leading the journal.
Thanks for your comments.
Samin Iqbal, did you want to unmute and join the conversation? Otherwise, so one of the questions here is publications coming from the private medicine sector. Is that something that you're seeing more of?
That is a difficult question to answer, actually. I would say no. However, there are some privately owned databases now. So we have seen submissions out of privately owned databases in the US that answer the same questions as large population based studies do. Drug databases that will look at side effects or adherence or outcomes. And they are definitely from private companies with people with interests. But I wouldn't say it's very much on the rise. Still, usually papers that we get are usually from publicly funded work that's done by academics.
Thank you. Dr. Doss, did you want to unmute and join the conversation?
I wrote a few. I don't know which one you're referring to.
And go ahead and just with your comments or questions.
Yeah, there was Dr. Westlake, published in Science said that published for years and years, and he was on a 2.6 billion annual budget, and he published so much falsehood that we have to be careful of even what's published in the most renowned public journals. Just a comment.
Yeah, I mean, good comment. And what I would say is that con men exist in every business. We can't assume that folks in academia are always 100% altruistic. At the university that I graduated from, there was a man who I think through good intention fabricated data on a breast cancer study and was exposed at the International Cancer Society conference about 10, 12 years ago. And it was kind of shocking because I knew him personally and he seemed a devoted guy to his patients. But obviously people get on a thing of wanting to prove their own particular theory, wanting to show that they're right.
Are there any other questions in the room, Natalie? Dr. Diane?
Thank you so much for this talk, and I just wanted to a comment and a question. So the comment is really about the podcast. So I did listen to your podcast. It was fantastic. It really is better than the JAMA podcast, which is really more of a snippet, kind of basically reading out the abstract, whereas the CMAJ podcast really have very in-depth, interesting discussions with my man and one of the authors, and highly recommend it.
Thank you.
Platform. My comments is about comments as much about how difficult it is to find reviewers. This possibly is what's slowing down the process. And I know in some journals there, well, I've seen sort of on Twitter discussions about compensating reviewers in different ways, not necessarily financial remuneration, but other kinds of ways of compensating reviewers for this actually very tedious work.
So that's a really good question. We, as part of our strategy for this year, have a project to work out how we can better reward peer reviewers. Unfortunately, we are not in a position to compensate them, aside from the fact that we compensate patient reviewers. But other journals have used other kinds of incentives. So, for example, if you're a CMA member, if you're new review for the journal, you could get a discount on your next publication in CMAJ, but that's if you get to publication sort of thing. Another thing is something that's easy to transfer to your record that you accumulate to apply for professorship or advancement. And there are some facilities that are available to do that, so that they will send you some kind of a certificate or something. What the BMJ did when I was there was they were paying their peer reviewers and then they couldn't anymore. So what they did was that they offered them a free subscription to the BMJ for a year, everyone who reviewed. Well, that won't work for us because all our stuff is free. So we have to think about other things. But the other thing is, another way is to increase the supply of good reviewers. So to encourage mentorship programs, to create educational materials to guide people in how to peer review, and that's something that our journal could also offer.
Can you make it? We have 1 minute left. There's a question that came in on social media and the podcasts. What else are you doing in terms of social media to get the word out?
Yeah, another interesting question. So social media it's capricious. We had a bunch of good followers on Twitter, and it was a good community until it wasn't. And the CMA recently decided that they were not going to be posting on X anymore for ideological reasons. And we had a chat about it, and we talked about our existing followers on X, and they didn't say that we had to come off it, but we decided it was probably a reasonable time to do that and transfer over to Blue Sky. We were now building a new following. But it's also tricky because I think that even if you think you have good interactions on social media, you don't really know what that is. It could be, or you don't even know if the people who follow you are seeing your stuff, because the algorithms right now are so opaque. So it's hard to know how much resource and effort and time to put into social media.
Fantastic. Thank you very much, Dr. Patrick. It is 1 o'clock, so we will have to close out the rounds. I know there's several people today meeting with Dr. Patrick, so thank you for this fantastic presentation. Congratulations on the work you're doing on the CMAJ, and thank you for sharing all this with us. Thanks, Rita, for organizing this. I wish everyone a great afternoon. Thank you. Bye-bye.